For many decades, we were actually doing genetic testing without knowing that this is a genetic testing. Of course, the professionals know, like a double marker screening. Earlier, there was a triple marker. So this double marker is done to understand whether the fetus is going to be at risk of developing Down syndrome or not. Down syndrome is actually a genetic disease. It is caused because of a presence of an extra chromosome 21. So this simple information, it is a screening test. We have all gone through now COVID testing. We have seen then there are screening tests like an antigen testing we have done to understand who are at risk. And then if somebody has come positive in the antigen test, we have gone further to RT-PCR to confirm their diagnosis, whether they are actually affected with COVID. Similarly, the screening is for everyone. We acknowledge, not only us, all the international guidelines acknowledge that this simple genetic screening testing or test should be offered to all the pregnant women irrespective of their population. Okay? So if you come to our population, then genetics, again, very important. In Eastern India, we have all heard about thalassemia. Everybody must have heard about thalassemia, right? Sir already gave it. If you go to any kind of medical facility from the government, thalassemia is the first test which is written there for a pregnant woman. Why? Because in our population, there is a very, very high frequency of thalassemia carriers. It means they have the faulty gene, but they do not express. But if the faulty gene comes from both the parents to their children, then they can be affected, right? So this brings to another very important thing, that how important is to understand that if we are going to be carrier for certain diseases, unknowingly, like the rare diseases you said, there are many diseases right now which can be screened beforehand. It can be during your pregnancy or even before the pregnancy if you are planning, right? We call them as a carrier sequencing to understand if your future children will have any risk of developing any kind of rare diseases.